For all of you, since you've never met me before, I'm Arbian Benga. I'm one of the physical therapists here at Smart Body. The topic today, just like you might have already seen, is keeping your back safe this holiday season. We hear a lot about back pain. I mean, almost every other commercial is something about back pain related, right? And there is a reason behind it, right? It's one of the most common injuries that we have in the United States, almost and all over the world. As you can tell, half of all the Americans admit to having back pain symptoms each year. So, and that's second most common reason to upper respiratory infection, which apparently is more. I just learned that earlier. Now, most cases of back pain are mechanical, which means that they're not really coming from serious condition. They're not arthritis, which most people always relate back pain with arthritis. You're like, oh, I have arthritis, back pain, it makes sense. Not necessarily, right? They're not coming from infection. They're not coming from fractures. All these things are another reason why someone has back pain, but they're not the most important reasons. So, which means that one of the most important reasons, I'm going to start from the bottom, right? 2/3 of all back pains are like strains, right? Caused just from lifting, either pushing or pulling. So, we can fix the lifting, which means that we can fix 2/3 of all the back pains. Now, we might not fix 100% of all the lifting, but we can work. At least that's something that we're in control of the lifting versus the other ones, right? We're not really in control of that as much. So, but 2/3 of all the back pains are things that we can work on, and we can hopefully eliminate all that. Now, 50 billion each year is spent on just back pain cause. That's a lot of money, right? And 80% of the population will experience back pain on their lifetime, which means that 50% of people say they have back pain each year, and 80% of all that in their lifetime will complain of back pain. So here in the clinic, we see a lot of back pain, right? It's one of those things that we see the most. We have great success with treating, just because understanding of what the presentation today is going to explain. The goal of back pain is preventative, right? Is hopefully we don't let it to go to back pain, but just knowing some of the things that we're going to present today, it's just tricks to like eliminate or prevent back pain, or if it's too late, we already have back pain, now how can we fix it? Now, what causes back pain? Back is very complicated structure, right? Bone, joints, ligament, muscle, and a lot of reasons. We can sprain a ligament, we can strain a muscle, rupture a disc, irritate a joint. All of these will cause back pain, right? Now, that says sports injuries. So while sports injuries, other accident, which we can't really kind of predict those, it's an injury, right? You don't really expect that to happen. We can't do too much about that, but even the simplest movement, picking up a pencil will cause back pain. And just like we were saying earlier, right? You can do a quick movement and you're like, I shouldn't have done that. So most of the injuries that we have or we see and treat, it's from very easy, simple movements, and that will cause a back pain. And then that's going to repeat itself over and over again if we don't do anything about it. Or what we see the most is you do something about it, gets better, then kind of fall off a little bit, and then when it hurts again, that's when it will remind you that, oh, I guess I should have kept with what helped the first time. Now, the topics that we're going to present today, just like they were on our handout: posture, which is huge, right? Maintaining our back's natural curves, proper lifting technique, strengthening your back, desk ergonomics, and flexibility. And you'll see that I'm going to repeat myself a lot because on each category they're very related to each other, right? Posture goes very well with maintaining our natural curves. And that's all we're trying to do on the posture, is to maintain our natural curves, right? The proper lifting and strengthening your back, again, they go hand to hand. A stronger back will help during your lifting, right? Proper lifting means that you don't have to have that strong of a back as long as you lift it properly. So they all go very related to each other. Now, posture. We have a lot of different postures. We'll start from normal. And what do we see on the posture? As you can see, we'll see what our spine is doing of us just standing. We can have the normal posture right here. As you can see, the spine, we have the natural curves, which is the cervical lordosis right here, which means a curvature, right? And then we have our thoracic kyphosis, then back to a lumbar lordosis. So we have this very nice, smooth back and forth curves, right? We always use the picture of the spine as in our body is straight, so that means our spine is also straight. right? Natural curvature has to have a little curve, and that's what we want. So everything that we do is trying to maintain those curvatures and not to like straighten out our spine. So when we run into trouble is with these other things. Like let's skip this one and go straight to what I was saying earlier, the straight spine, right? This is like the military posture, right? Now, when we have straightened the spine, the line, this is the line of gravity, is in front of the spine, right? So which means that we're putting more stress to it because the weight is in front of us. In order for us to just balance that, we have to stand in this posture to throw some of this weight. Look where it's on your head. Now it's not on the middle anymore. You have to throw your head backward in order to balance what the front is doing. Stomach is forward, head is backward, and our spine is straight, right? So the body will do this on its own, right? We don't really think about it. You can just assess your posture on your own and then, or have someone look at you, see how you stand whenever you're not paying attention. And then it's going to really show what your posture is like. This is the extreme, like this is like the gymnastic posture, right? You see the young gymnasts, they have this really increased lordosis of here. Well, that comes because all the bending backwards that they do, so they have really increased their posture here, right? Eventually, I mean, you can see the strain that we have on our back, and then everything else doesn't look too bad, again, but we only have a little bit of shift, and most of these people will have that instability of the low back, right? And when I say gymnastic is what you can think about, but a lot of people will walk around with this posture, right? Now, when we run into troubles, the most is right over here. This is the forward head, right? And a little bit around the shoulders. And then we have the protruding stomach, which you can do anything you want. You can have the best diet in the world, and you're like, how come I'm not losing this weight over here? Well, that's because this weight over here is not really necessarily weight loss, right? This is poor posture. This is poor strength. Now, because we have this forward head motion, now we're changing the way our gravity pulls on us. Look at it. It's all the way back, right? Gravity is pulling all the way back. So in order for us not to fall back, we'll start to put everything forward. So head is forward, stomach is forward, everything. Look where the line of gravity falls. Everything is forward. So on someone like this, what I would expect to see on the front, they have really tight quads, right? Because they have really tight in front of like their shins, right? Very tight on their pecs. And this is the most typical. This is like working on a desk, right? Head is forward, shoulders forward. We're putting everything in front of us, and then eventually, even when we stand, the body is going to accommodate to kind of almost the same posture. So you sit, you're going to calculate what you do the most during the day. If sitting is what we do the most, well, even when we stand, the body adapts to that sitting position. So when we sit, most of the weight is in front of us. When we stand, most of the weight again is in front of us. So that's why, like, just knowing the posture, where you fall on this posture, right? If you tell yourself, I'm here, check, right? You don't have to work on it, right? If you tell yourself, actually, I see like I'm more over here. Most of the time, you don't even know where you fall, right? You need another expert's opinion to see, to really look at your posture and see where exactly you fall in these categories. Now, this is more the picture of what it looks like. A little exaggerated, but it kind of gives you the idea of what I was telling earlier, right? Perfect, good posture. This is that forward head posture that I was telling you about, right? And then you can easily see someone with this posture because they're in this position. This might be a little bit more exaggerated, but you'll be surprised. You can see people walking around like this, and it's very common, right? This is what we see the most outside just because of what we do. Sway back. Again, you don't see too many of people walking around like that. But again, this is another one. And that's what I was telling you earlier with a gymnast. The very increased lumbalordosis. And guess where they're having pain? Right there, right? Well, guess where these people having pain the most, right? Right over here, which eventually is going to transfer down and lead to back pain as well. These people having pain. Now they're collapsed. This is just like the thoracic kyphosis, like the hunch over position, right? They're having that shoulder blade right in the middle of the shoulder blade. You're like, it's the kind of pain that you can't do anything about it because you can't reach it this way. You can't reach it this way. Is at the line that you just need another hand to kind of push right on it, right? So, this is what I mean about posture. And the goal, obviously, it's nice, normal posture, right? We can't really fix the posture too fast because posture didn't really, you didn't wake up in the morning looking like this, right? It built to that. And what we do during our day, lifestyle has a lot to do with it. And then 20 years down the road, we ended up looking like this. So it doesn't take another 20 years to try to reverse that, but it will take time, right? We have to do things right and slowly. Right? So some people like this, they have neck pain. You're like, I've seen you 2-3 times, or I've been doing some exercises for a month. I don't think it's helping yet. Well, it's not enough time, right? We want things to get fixed very quick because that's what pills claim. So why am I going to go through exercises or trying to do all these things right and wait all this time when I can just eliminate the pain from something that does it just like that? So I mean, on our society, which makes sense, who wouldn't like a quick fix or a quick snap the fingers to hide? You're not really fixing anything. You're just putting a band-aid until you take it off later and you're like, I guess I didn't really fix anything. Benefits of good posture. I mean, we already know most of them, right? Allows us to move more efficiently. This position over here, now if you want to stand and try it, in this position, try to raise your arm as high as you can. I mean, this is all I can do, right? Because I'm already locking my head in this forward position. This is the best I can do. Versus, right? So now you're already on this posture, and you want to pick something high, and this is the most you can do, right? We're stressing our back. We're doing all these things all because of posture. If we were fix the posture to begin with, then we have all this extra mobility that we never thought we had to begin with, right? So that's, again, posture, it's one of those things that will affect everything else we talk today. Improve muscle function. If the muscle has the full range, it will perform better. My muscle over here, it's being stressed just to keep my arm here, and now add another weight on top of what's already being stressed. So muscle is kind of working more than it has to just to do something that doesn't feel as much as we will think about it, right? And then increase range of motion, same here versus there, right? Takes pressure off and compress organs, right? All this is related. Poor posture is going to just affect our breathing. Like how many of us here feel that even breathing is a little bit not as easy? On this posture, we're so closed in, right? Our chest wall, the ribs, everything, if we're in this posture, our lungs are being compressed and now we're trying to breathe. It's like someone is holding you from the back and you breathe against that. You're actually breathing against this resistance that is there and shouldn't be there, versus if we're in a better posture, now we have all these, the rib cages can elevate and raise much more easier. And that's affected by posture. Like you can just see when we've treated here, just by improving the posture, you just feel like you have more energy. You're like, how does it even make sense? I improve the posture, now I can do more things because your breathing is more efficient. Your ribs are moving better, right? It's like two things that you don't think they go hand to hand, but if you put the relation together, you're like, well, I guess it makes sense. If I can breathe much easier, well, guess what? I'll have more energy to do more things. And it's all related to, right? On this posture, we're only using most of the upper lungs because diaphragm here is all stuck on our rib cage, versus here we're kind of like just opening up all that area. And the last one, I really like the one. Radiates an attitude of confidence, right? I mean, this seems much better than, and I would look tired if I walk around like this, right? It can be 8 a.m. in the morning after your morning coffee. You look tired. Yeah? Someone's going to ask you, oh, I guess you had a long night? Yeah, not really. Why you ask that? It's just what you radiate, right? Versus you walk like this at 10 a.m., you're like, oh, you looks like you had a good day, right? It's our attitude towards something. And posture will show you. And most people will pick up your posture much more than we pick up our own posture. right? Kind of the same idea as in someone else will tell you that, raise up your shoulders. You're like, oh, I wasn't even thinking of that, right? So posture is, fixing the posture, another person will see it much faster than you will realize that. Now, maintaining our natural curves. Again, it's all related to the posture. Now, the natural curves of our spine, if you see the spine, or if you've looked at like our vertebrae, we always talked about, we like the curves, right? We want to have a little curve on our neck. We want to have a little curve on our back, because that's how we can distribute the weight from our head all the way to the ankle and down to the gravity. Like a flat building, that means that you're stacking all this weight on top of each other, and this guy here at the end is going to hurt. You're putting all that weight directly into the very last. Yeah, but if we put this nice and round, and then we can distribute the weight throughout our muscles, then that's when the muscles are very important to have strong muscle, because they will take the tension of our skeletal system, right? We can lock our knees, and I'm just hanging on like my ligaments right now. I'm not even trying to do anything. My muscle are kind of falling asleep. You can just set yourself into a position that you won't fall just by loading all your joints. Or versus you can try to move around and really have the muscle distribute the weight. If your knee hurts, arthritis, and you stand still, that still hurts. You move it a little bit, that means that now you're distributing the weight through the muscle, and you're like, wait a second, actually moving, it's better than standing still? Yes, because when you move, you engage in your muscles, which are taking part of that stress and that weight. Why a sitting job is not good? Because we're not doing anything. All the gravity that is pulling on us, our muscle are not doing anything about it to like take all the tension. Is we're sitting. Our back hurts when we sit. It makes no sense. You're sitting. Why does your back hurt, right? Now, the main things is on this where we have a little bit of increased lordosis, right? Look at where the tension and the tightness is. We always think of like, my back is weak, so my back hurts, right? That's what will make sense. Oh, I have a weak back, so I need to strengthen my back, this and that, but not necessarily what we come to find out. Your back is tight, not necessarily weak. Guess what's weak? The front, right? So weak is blue. So in all of these over here, you never see blue directly on your back. Your back is not weak. It's tight. It's overworking. It's taking a lot of tension. You're sitting, you're loading your back, right? You're standing, eventually you're loading your back, right? So your back is always tight. Other structures usually are weak. And that's why today's presentation is trying to get all these misconceptions out, because people trying to fix their back with exercises, but we're doing the wrong thing, right? It's like, oh, let me strengthen my back because my back is weak. Your back is super tight. You're trying to strengthen it. Your back is super tired to begin with. So we add exercises on top of that. Whew, it's not helping, right? Now, here, this is where most of the tension is on our spine. C5, neck pain, right? How many people have neck pain? T12, this is the mid-scapular, right? And across shoulder blades. This is how much tension we put right on that region, right? And then, of course, our low back, look at which this will take the highest amount of tension. The second highest amount of tension, and then is, so all these area here with red is where we experience most of our pain due to tension, due to like structures, the way we sit or stand or just posture, right? Or so neck pain, mid-scapular pain, back pain. Makes sense, right? That's where you're gonna hear the most with everywhere you go. Now, this is what I was trying to tell you earlier, right? We have a lot of muscle imbalances, and that's what a good therapist or a good trainer or someone that is expertise on that, that's what it realizes. Sometimes like, why do I need to see someone to strengthen my back? I can do it on my own. Yeah, but then you come to find out that maybe that's not what you needed, right? We need to find out what are your imbalances first. So we have to, a lot of people overstretch. You're stretching the wrong muscles, right? We have to stretch the right muscle, right? We do core training. How many times you hear, oh, you gotta do some core training? What does exactly that mean? Right? So sometimes I'm still confused. What's core training, right? And this is your core. That means it's front, side, back. What do you mean by that? right? So that's why, like with maintaining the natural curves, right, we're trying to strengthen the back is a little bit more complicated when when we don't know much about it. But as we come to understand that, wait a second, we have to first find out what's causing this pain and then fix it. How are we fixing something that we don't know what's causing it, right? So most of the time, this is 99.9% true, and this is my statistics, right? You won't find it anywhere if you Google it. We always have this problem. We have weak abdominals, weak glutes, very tight lower back like thoracolumbar extensors, and also very tight hip flexors. And this here will match exactly this. Weak, we're not using them, we're just sitting, right? Weak glutes, we're not using them, we're sitting right on top of them. Tight, right? These are tight because we're kind of bending them forward. And then tight, because this is paying for it. Right? So that's exactly, so even when we stand, we have the same problem because sitting too long, it's leading to that problem. I mean, that's today's society. We sit everywhere, right? We drive, at home, sit, at work, you sit. I mean, if you compare how many hours a day we sit or do any kind of activity that involved that posture versus anything the opposite of that, can't even compare, right? So even when we sleep, what position is your most comfortable, right? That exact position, because that's what the body wants to do, right? That's what we do all day. Tell someone, like, do you sleep on your back? Right, with our arms open like this. Now, even if you do sleep on your back, it's probably you wake up in the morning with, my back is very tight this morning because I sleep on my back. Because it doesn't like it. It's tight to begin with at night. So you sleep and didn't really do anything about it. It's tight in the morning. So lifting techniques, it's huge, right? That was one of the main reasons why we having all this problem to begin with. We're hurting ourselves lifting things, right? I really like this chart because it explains to you that it's not really the weight that we're lifting that causes the pain, it's how we lift it. Now let's say on the normal individual, we're talking about 80 pounds of weight is on our back when we're standing upright. Let's say, I don't know, 160, 170 pounds, we're talking about 80 pounds. Just the upper body weight. Anything from lower back